earlier we talked about concerns over the vaccine rollout, but there's something else that's on people's minds. A new, more contagious variant of the coronavirus is popping up in several countries. President Biden is so worried he has reimposed a travel ban for most of Europe and several other countries. So, of course, we got to turn to our medical expert, Dr. Payal Kohli. Dr. Kohli, so good to see you. So tell us now, are the vaccines effective against the new variant? I know a lot of our viewers have written in that question and they're concerned.
Yeah, we are all really worried about this, Sam, and the good news is that we do have some studies suggesting that they're effective. So what they did is they took people who had been vaccinated, took their blood and mixed it with the virus to try to see if their antibodies fought off the new variants of the virus. And the good news is, like I said, they did, but I want to make sure that everybody realizes that the efficacy was reduced. So there was a small but significant reduction in the efficacy, and what they said was that 14 out of 17 of our strongest antibodies were not working as well. So based on this, the companies, including Moderna, have now actually started thinking about booster shots, actually a third dose of the vaccine that they're piloting to try to see if we may even need a third dose to try to address these variants.
Wow. So, Doc, a lot of talk about wearing 2 masks. We can't even get people to wear 1 mask. But does wearing 2 actually help you not contract this new virus?
Yeah, you know, you're absolutely right. It's even challenged to get the 1 mask, but experts are recommending now that people wear 2 masks. And if you think about it, it makes a lot of sense. The more layers of fabric or material that you have, the more protection you have from this more contagious variant that spreads more efficiently, and the more protection others have from you and your droplets. So you are going to make an impact in the spread of this new contagious variant if you double mask. And I like to think about it like we're running a race with this virus. And suddenly the virus got a lot faster. So we have to do something for us to get faster. And until those vaccines can really be administered, which is months away, this is one of those things we can do to try to get our edge back and try to, you know, catch up again to our opponent.
All right, well, speaking of months away, Doc, since the vaccine rollout is taking longer, how can you prepare for your turn? Like, what should we do?
Yeah, some of us are already there, but for others it'll be longer. So there are a few things you can think about getting your body in the best shape possible for that vaccine. So the first is that you don't want to take any other vaccine within 2 weeks of getting the COVID vaccine. So you want to plan all your immunizations now if your turn for COVID is not up yet, because you don't want your immune system to be distracted fighting something else when you're supposed to be mounting those antibodies against the COVID virus. The second is you don't want to pre-medicate. There's a lot of talk on social media about taking an ibuprofen or Tylenol before you go for your vaccine. That's not something that's recommended because it could suppress the immune response. We don't know, and so it's not something you should do prophylactically. And then the last one is actually for you, Al. No more day drinking, because alcohol has actually been shown to suppress the immune system. So I really want to encourage people to start to peel back on their alcohol use as they're preparing to get the vaccine, because if you've got chronic immune suppression from the alcohol, you're not going to have the kind of robust antibody response that we would want you to have.
Before we go, I have a question, and you may, I'm sure Dr. Kohli have answered this before, but let's say, you know, people are vaccinated. If you yourself are vaccinated, but you were exposed, you're not going to get sick, but do you still carry it and can get other people sick, or no?
This is an excellent question, Sam, and in the answer, we don't know yet. We're still waiting to find out, but this is one of the main reasons why, even after we get vaccinated, so I've been vaccinated, I'm still double masking. It's not because I like to do it, but it's because I want to protect others from me, because it's entirely possible that my body can fight off the infection so I don't get sick, but I'm still giving off that virus in my droplets when I talk or when I breathe, and so others can get sick if they haven't been vaccinated. So I know it's discouraging to hear this, but as more of us get vaccinated, I promise you our lives will get back to normal. We just have to be patient for everybody to get their vaccine and everyone to be protected.
Well said. Thank you so much, Dr. Kohli. We'll be right back.